Doreen Grand-Pichet is the
Dr. Doreen is an expert in autism.
Doreen Grand-Pichet.
Dr. Grand-Pichet.
Dr. Doreen Grand-Pichet.
Dr. Doreen Grand-Pichet is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen.
One from Canada who says, they're not even giving us this speech therapy. So aside from, we are going to be giving you that speech and language pathologist who's going to take little lessons at a time so that you guys can have something, an activity to do with your kiddos. But until we have that for folks, and while we have that, Dr. Grand-Pichet, what do you recommend?
Yeah, so, from a behavioral perspective, first of all, let me back up and just say, because there's a lot of questions coming in and asking about sort of speech versus ABA. And yes, you do a lot of speech type activities and language type activities in ABA. There's no question. I usually recommend speech therapy when, different reasons. One reason is sometimes you can't get enough ABA, and then I want your child to be packed with activities. I would recommend a speech therapist separately when your child is plateauing in their language with their ABA program. Speech paths have, especially speech pathologists who are trained in methods like the prompt technique, they have ways that they will get your child to initiate vocalization or sound, and then to connect that to various objects. And they're better at that portion. So that helps, and then through ABA, obviously, you reward that, right? So when the child finally says cup, for instance, you will actually make sure they get access to a cup, or they know that this is the label for this object. So if you have a speech path, and speech paths, by the way, usually will only do 2 or 3 hours a week with a child. It's unlikely that they would do more than that. And whereas ABA, as Shannon said, should be happening anywhere between 20 to 40 hours a week in most cases. And that's like where a lot of the work is done. The combination, I'm always for bringing in disciplines so that you are not missing anything, right? I'm overseeing a child right now, and our team is pretty extensive. I mean, I have about 4 or 5 really well-trained behavior analysts, and then I have behavior technicians. I do have a speech pathologist. I have 2 OTs on the case. I also have the child working with a nutritionist, a physician who can take care of all the medication and make sure the child is healthy and all that. The nutritionist watches over the diet. And then, of course, on top of that, we have like a variety of different people, like hippotherapy and yoga and a lot of other types of resources. So I want to make sure my child's getting expertise from every possible area that they can. But if you're in a country where you can't access these services, and if you're like thinking, how do I get my child to vocalize? There are a lot of different things online when you look online and just look for initiating speech through ABA or initiating speech through speech therapy. There's a lot of little exercises. It's really just about producing a sound, and you reward that, and then whenever that sound is produced, you connect it to an object. I know it's hard to explain, but it is a lot of work, and I saw that someone else had written, I thought it was just a few months. It's this type of stuff, getting a child to vocalize and then get to conversational speech, for instance, could take 3 years or more of intensive work. So please don't be discouraged, and just keep going and keep progressing, because our kids also, the good news is I've always seen that our kids, once they have a certain level of comprehension of language, they start to pick it up from their peers, and they start to learn a lot faster from their environment. It's just that the very first year or two, our kids are not really paying attention to the speech of others. And so once you get them to a point where doesn't sound just like babble to them, it sounds like words, then they start to pick it up from other kids, from you, from TV, from computers, from everywhere, and it accelerates, and they learn faster that way.
Yeah, this is all hard stuff. And I see a lot of people making comments about access to things and the amount of time and discouragement. I always think about what Nancy Allspot Jackson always says, be a dog on a pork chop. You really got to pack your backpack on this one and say, we're on a journey and we're just going to keep moving in a direction. And we don't know where we're going to end up, but we're just going to keep on moving, be a dog on a pork chop. Every day, well, the thing that you say all the time, Dr. Grampiche, if you do enough of the right things often enough, good things happen.
Yeah.
And so every day you find more ways to just inch it along a little bit more, and you'll find that you really get to some incredible places. I want to say hello to Fatima, who says, hi, dear Dr. Doreen and Shannon. It's always great to see you. Special thank you from my sister in Switzerland for all your help. Love from all of us to you both, and back to you as well.
If you found anything helpful in this video, please give us a like. In fact, make sure that you smash that subscribe button on YouTube and give us a like on Facebook. You can also follow us on Twitter and Instagram for important updates. And please download our free podcast wherever you get your podcasts. See you next time. Until then, give your kiddos a hug from me and one for you too. Bye-bye for now. To subscribe, click here. And if you'd like to check out some more of our videos, click here.